There's a state where 61% of rural hospitals are now vulnerable to closure, up from 44% in a single year, the steepest jump in America, where 18 hospitals have already closed or stopped admitting patients since 2010, and where the nearest emergency room for some residents is now over an hour away by car. The state is Tennessee, and it's not even the worst on this list. While everyone's been arguing about healthcare policy in the abstract, the actual hospitals have been quietly switching off the lights. Not all at once. A wing here, a maternity ward there, an entire building in a town that won't make the national news. According to the Center for Healthcare Quality and Payment Reform's January 2026 analysis, 734 rural hospitals, roughly 1 in 3 in America, are now at risk of closure due to severe financial problems. According to Chartis's 2026 Rural Health State of the State report, 41.2% of all rural hospitals are operating in the red, with 417 vulnerable to closure right now. According to the same Chartis data, 23 hospitals closed or stopped inpatient care in 2025 alone, with more already gone in 2026. And here's the part nobody connects. The One Big Beautiful Bill, signed in 2025, is projected to cut roughly $140 billion in Medicaid funding from rural hospitals over the coming years, hitting the exact facilities already running on fumes. In this countdown, we're exposing 10 states where hospitals are quietly disappearing in 2026. Not the loud version with a press conference, the quiet one, where the maternity ward closes and the next town finds out when somebody goes into labor 90 minutes from the nearest delivery room. One state on this list has 86.2% of its rural hospitals operating in the red. That's not a typo. 86.2% of every rural hospital in the state is bleeding money. Another has lost 27 rural hospitals to closure since 2010. A third has seen 71% of its rural maternity wards shut down, while the state's tourism brochures still talk about it as the perfect place to retire. Subscribe before your county's hospital makes the list. Like the video if your hometown lost its hospital or is about to. Let's break it down. Number 10. Alabama, the yellowhammer state where the rural safety net has been fraying for years, and 2025 was the year it started visibly tearing. There's a state where rural inpatient care has been disappearing through 2025, where the share of rural hospitals at risk has climbed steadily, and where the combination of low income, declined Medicaid expansion, and limited healthcare infrastructure has put older residents under particular strain. Welcome to Alabama. The numbers. Alabama saw inpatient care disappear in rural communities during 2025, per Chartis 2026 analysis. Alabama has roughly 28% of rural hospitals at risk of closure, with a high share facing immediate risk per CHQ-PR. Alabama has not expanded Medicaid, a factor Chartis identifies as statistically significant in predicting closures. Alabama home insurance averages $4,082, the 7th highest in America per Insurify, adding household cost pressure on top of healthcare access pressure. Alabama's senior population has grown alongside broader Sunbelt retirement trends, putting demand on facilities that are simultaneously shedding services. What it's like. Living in rural Alabama is like dating someone who keeps insisting the relationship is fine while their friends quietly disappear one by one. Picture this. You're a 68-year-old in a small Alabama county in 2026. The hospital that used to be 20 minutes away is now a building with the lights off and a sign pointing to a facility 2 counties over. Your specialist appointments require a full day of driving. Your cardiologist is now in Birmingham, 3 hours each way. Your wife had her hip replaced. At the local facility in 2015. That wing closed in 2023. You're starting to research which hospitals are still open if something happens at night. Where it gets uncomfortable. The decision to refuse Medicaid expansion has been described in policy terms for over a decade, but the consequences are physical and geographic. Alabama rural hospitals lost the federal partnership that expansion states kept, and the uncompensated care wound has stayed open. The reform conversation continues to focus on other priorities. The hospital map keeps thinning. Sharp contrast. Alabama and Kentucky tell 2 stories. Kentucky expanded Medicaid in 2014 and stabilized many of its rural facilities. Alabama refused, and the rural margins kept tightening. Same region, opposite policy choices, very different rural hospital maps. Number 9. Florida, the sunshine state that markets itself to retirees, then quietly closed 71% of its rural maternity wards. There's a state where rural obstetric closures are the worst in America by a wide margin, where more than 41% of rural hospitals are at risk, and where the gap between the retirement marketing narrative and the actual rural healthcare reality has widened to absurd proportions. Welcome to Florida. The numbers. Florida has the highest rate of rural obstetric closures in America, with 71% of rural OB units shut down per Chartis. Florida has more than 41% of rural hospitals at risk of closure per CHQPR January 2026 analysis. Florida has not expanded Medicaid. Florida is among states where 40% or more of rural hospitals stopped offering chemotherapy services, joining the worst tier nationally. Florida average home insurance hit $7,562 in 2026, the highest in America per Insurance.com, adding cost of living compression to rural healthcare deserts. Florida's deaths have outnumbered births since 2020, with the deficit projected to hit 50,000 by 2035. What it's like. Living in rural Florida is like dating someone who advertises themselves as the perfect retirement and quietly forgot to mention the part about the maternity ward. Closing. Picture this. You're a 33-year-old in a rural Florida county in 2026. You're 24 weeks pregnant. The nearest delivery room is now 70 minutes away. The next nearest specialist is in Jacksonville. Your insurance covers a maternal fetal medicine consult, but the consult itself requires the drive. You're starting to plan how to make a labor emergency work when the closest hospital with maternity services is 70 minutes on a quiet day, and longer when the I-95 traffic is moving. Where it gets uncomfortable. Florida's retirement migration economy depends on a narrative of safety and stability that the rural healthcare collapse undermines. The state has been losing condo retirees over the insurance crisis. The state has been losing pregnant women over the OB desert. The rural counties carry the consequences of both. Sharp contrast. Florida and North Carolina both have large rural populations. North Carolina expanded Medicaid in 2023 and stabilized rural margins. Florida refused, and the OB desert spread. Same coast, very different maternity maps. Number 8. South Dakota. The state nobody expected on this list, where rural hospital vulnerability nearly doubled in a single year. There's a state where the share of vulnerable rural hospitals jumped from 28% to 42% in 12 months, the second steepest increase in America after Tennessee, where vast geography means a single closure can isolate entire regions, and where the trajectory has caught most observers off guard. Welcome to South Dakota. The numbers. South Dakota saw vulnerable rural hospitals jump from 28% to 42% in 1 year, the second steepest increase in America after Tennessee, per Chartis 2026. South Dakota's vast geography means a single closure can leave residents hours from the nearest hospital. South Dakota's rural facilities operate with thin reserves against high fixed costs. South Dakota lost inpatient care at facilities during 2025, per Chartis. South Dakota's frontier counties are among the most isolated in America, with multiple counties classified as frontier by federal definition due to extremely low population density. What it's like. Living in rural South Dakota is like dating someone you thought was stable, who just announced they're considering some major life changes, and you're realizing the relationship was less stable than you thought. Picture this. You're a 71-year-old rancher in central South Dakota in 2026. Your local hospital was steady for 30 years. Last year it cut its maternity ward. This year it cut its surgical capacity. You're calculating the drive time to Sioux Falls when something serious happens. The drive is 2 hours when nothing's wrong. The drive is 2 hours when something is. You're starting to plan your medical year around what the local facility can still do. Where it gets uncomfortable. South Dakota's frontier population was small enough that the rural hospital math worked only because of federal partnership and stable reimbursement. Both have been compressing. The result is a state where rural healthcare went from background concern to active crisis in a single year. Sharp contrast. South Dakota and North Dakota are twin plain states. North Dakota's rural hospitals held steadier. South Dakota's vulnerability nearly doubled. Same prairie, very different year. Hey, before we get into the top 7, the states we're about to cover are the ones where the hospital closures have been documented in Chartis's Rural Health State of the State report, in the Center for Healthcare Quality and Payment Reform Analysis, and in CMS cost report data verified through late 2025. If this list has been useful, hit subscribe because the next one we're working on is 10 American cities where the property tax bill just doubled, and you'll want the names. Like the video if your town lost its hospital, or watch the maternity ward close. Drop a comment if you've had to drive an hour or more for emergency care. Real conversations happen in the comments, and I read them. Now let's keep going. Number 7. Georgia. The Peach State, where 25 rural hospitals are vulnerable, and the maternity care is vanishing faster than the buildings. There's a state where the rural hospital crisis runs alongside some of America's highest rural diabetes and obesity rates, where Medicaid expansion has been refused repeatedly, where Hurricane Helene compounded existing pressures, and where the communities with the highest health needs are losing hospitals fastest. Welcome to Georgia. The numbers. Georgia has 25 rural hospitals vulnerable to closure, the fourth highest count in America per Chartis 2026. Georgia has not expanded Medicaid. Georgia is among states where 40% or more of rural hospitals stopped offering chemotherapy. Georgia's rural diabetes and obesity rates rank at the 92nd percentile, driving demand the closing hospitals can't meet. Georgia absorbed Hurricane Helene's $5.5 billion in damage in September 2024, with significant inland flooding compounding rural healthcare strain. Georgia home insurance premiums are projected to climb roughly 19% across 2025 and 2026 combined per Insurify, adding cost pressure on top of healthcare access pressure. What it's like. Living in rural Georgia is like dating someone who keeps insisting they're fine while quietly canceling all the appointments you actually need. Picture this. You're a 64-year-old in rural South Georgia in 2026. Your diabetes management requires regular specialist visits. The local clinic closed in 2024. The county hospital cut its specialty services in 2025. You're driving 90 minutes for what used to be a 20-minute appointment. Your insulin refill requires a separate trip because the local pharmacy stopped stocking it after the clinic closed. You're calculating how to make all your medical appointments fit into 1 day per quarter so you don't drive 90 minutes every 2 weeks. Where it gets uncomfortable. Georgia. A's rural counties have some of the highest documented health needs scores in America. The same counties are losing the facilities that would address those needs. The mismatch is documented, predictable, and continuing. Sharp contrast. Georgia and Tennessee are southeast neighbors. Both refused expansion. Both are bleeding rural hospitals. Same region, same self-inflicted wound. Number 6. Missouri, the show-me state, where the show is rural, Missourians showing up at hospitals that are also barely showing up themselves. There's a state where 12 rural hospitals are at immediate risk of closure, where 10 have already closed since 2012, where the rural network has been hollowing out for over a decade, and where the financial margins of remaining facilities have stayed dangerously thin. Welcome to Missouri. The numbers. Missouri has 12 rural hospitals at immediate risk of closing per CHQPR January 2026 analysis. Missouri has lost 10 rural hospitals since 2012, with most in rural areas. Missouri Scotland County Hospital had a 8.5% total margin and 21.6% margin on patient services over the last 3 years per CHQPR data, meaning the costs of operating exceeded the revenue brought in. Missouri is tied for third in loss of inpatient care since 2010, with 11 rural communities affected per Chartis. Missouri received $216 million in rural health transformation funds for fiscal year 2026 from CMS, with the funds intended to address structural issues but unlikely to reverse the broader trend. What it's like. Living in rural Missouri is like dating someone with a great heart who keeps quietly admitting they're losing money every month and you both pretend it's fine because admitting otherwise means everything has to change. Picture this. You're a 59-year-old in a small Missouri town in 2026. The hospital that anchored Main Street for 60 years is on the edge. The administrator keeps saying it's manageable. The nurses tell a different story over coffee. Your kids have already moved to Kansas City or St. Louis. Your parents are still in the county and depend on the local facility. You're starting to calculate the cost of moving them closer to you, where it gets uncomfortable. The Missouri Independent reported that hospitals like Hermann Area District Hospital were back to losing over $1 million a year by late 2024. The local administrator described tough times ahead. The pattern across rural Missouri is the same. The facilities that remain are operating on margins that won't survive another bad year. Sharp contrast. Missouri and Iowa are Midwest neighbors. Iowa expanded Medicaid in 2014 and stabilized more of its rural network. Missouri did not, and the immediate risk tier kept filling up. Same region, different decisions. Number 5. Kansas. The Sunflower State, where 44 rural hospitals are vulnerable, the wheat-field distances make every closure a geographic problem, and the highest percentage of rural facilities in America are operating in the red. There's a state where nearly half of rural hospitals are at risk, where 86.2% of rural facilities are running negative margins, and where the cumulative weight of decades of policy choices has put rural Kansans further from emergency care than at any time in modern memory. Welcome to Kansas. The numbers. Kansas has 44 rural hospitals vulnerable to closure, the second highest count in America per Chartis 2026. Kansas has roughly 47% of rural hospitals at risk of closure per CHQPR. Kansas has 86.2% of rural hospitals operating in the red, the highest percentage in America. Kansas has not expanded Medicaid. Kansas has lost 12 rural hospitals to closure or conversion since 2010. Kansas received $222 million in Rural Health Transformation Funds from CMS for fiscal year 2026, with the funds intended to address infrastructure gaps that decades of policy created. What it's like. Living in rural Kansas is like dating someone in a state this spread out that closing a hospital doesn't just remove a building, it removes a region's only realistic shot at surviving a heart attack. Picture this. You're a 58-year-old farmer in western Kansas in 2026. The hospital is 45 minutes when nothing is wrong. The hospital is over an hour when something is. Your father had his heart attack at the local facility in 1998 and lived. That facility closed in 2019. The next closest facility is in another county. You've started carrying baby aspirin in your truck and rehearsing what to say to the dispatcher. Where it gets uncomfortable. The Kansas rural hospital crisis has been documented for over a decade. The state legislature has repeatedly considered Medicaid expansion and repeatedly declined. The federal Rural Health Transformation Funds will help with some infrastructure, but cannot reverse the structural reimbursement gap. Sharp contrast. Kansas and Nebraska are plains neighbors. Nebraska's rural hospitals are under less acute pressure. Kansas sits at the top of the danger list. Same wheat country, different margins, very different outcomes. Number 4. Texas. The state with the heaviest absolute burden in America, where 50 rural hospitals are at risk and 27 have already gone dark since 2010, the most of any state in the nation. There's a state where the sheer scale of rural geography means every closure isolates an enormous area, where Medicaid expansion has been refused repeatedly, and where the math of rural healthcare has produced the most extensive documented losses in America. Welcome to Texas. The numbers. Texas has 50 rural hospitals at risk of closure, the largest absolute threat to rural residents in America per Chartis 2026. Texas has lost 27 rural hospitals to closure or conversion since 2010, the most in the nation. Texas has not expanded Medicaid, with the largest uninsured population in America. Texas saw 51% of rural hospitals that offered chemotherapy stop providing it, tied with Mississippi for the worst nationally. Texas property taxes remain among the highest in America at approximately 1.74% effective per tax foundation, compounding household cost pressures. Texas's 1,245 active physicians per million population in rural counties is far below the national average, with rural specialty access among the worst in America. What it's like. Living in rural Texas is like dating someone who's enormous, ambitious, and keeps forgetting which counties they still own a hospital in. Picture this. You're a 73-year-old in West Texas ranchland in 2026. Your county hospital closed in 2022. The next nearest hospital is over 2 hours away. Your wife's heart medication requires a specialist visit every quarter. You're planning your medical year around those trips. The drive used to be enjoyable, with the open road and the sky. The drive has become a logistical exercise. You're considering moving to a small town near a regional medical center. Your wife doesn't want to leave, where it gets uncomfortable. Texas's scale magnifies every closure. A state with 254 counties loses a hospital, and an entire region of ranch land is suddenly 2 hours from an emergency room. The state has received federal rural health transformation funds, but the structural challenge of operating rural hospitals across vast distances persists. Sharp contrast. Texas and California both have huge rural areas. California expanded Medicaid and kept more facilities open. Texas refused and leads the nation in closures. Same scale, opposite safety nets. Number 3. Oklahoma. The Sooner State, where the rural hospital crisis is one of the deepest in America, and the prairie distances make it brutal. There's a state where a high share of rural facilities are on the financial edge, where 13 hospitals have already gone dark, and where the immediate risk tier is filling up faster than reform conversations can address. Welcome to Oklahoma. The numbers. Oklahoma has lost 13 rural hospitals to closure or conversion since 2010, per Chartis 2026. Oklahoma has been tied with multiple states for the third highest loss of inpatient care since 2010. Oklahoma is among states where 40% or more of rural hospitals stopped offering chemotherapy. Oklahoma has not expanded its rural health care reimbursement structures to fully offset federal pressure. Oklahoma's rural facilities face high commercial insurance underpayment, the single biggest driver of overall losses per CHQPR analysis, challenging the narrative that Medicaid dependency alone explains the crisis. Oklahoma has multiple frontier counties where the nearest emergency room is more than an hour away by car under good conditions. Reddit, quote, Oklahoma is the state where the rural hospital is technically open, and the locals describe it as a stabilize and transfer station, 90 minutes on a good day. What it's like. Living in rural Oklahoma is like dating someone who quietly tells you that the relationship works only when nothing serious happens, and you both pretend that's enough. Picture this. You're a 56-year-old in rural Oklahoma in 2026. The local hospital is technically still open. The labor and delivery ward closed last year. The surgical capacity was cut to outpatient only. The cardiology services moved to a regional facility 2 hours away. You've started keeping a list of which hospitals can do what. The list keeps getting shorter, where it gets uncomfortable. The Oklahoma RUH Rail Hospital Network has been thinning steadily, but the immediate risk tier accelerated in 2025 and 2026. The combination of declined expansion, commercial insurance underpayment, and federal Medicaid reductions has compressed margins faster than the reform efforts can address. Sharp contrast. Oklahoma and Medicaid expansion states diverge sharply per Chartis. Expansion states improved rural margins in 2026. Oklahoma stayed near the top of the danger list. Same crisis, different policy choices. Number 2. Arkansas. The natural state with one of the highest percentages of vulnerable rural hospitals in America, where the safety net is closest to collapse. There's a state where a majority of rural hospitals are vulnerable to closure, where rural reserves can cover patient service losses for only a few years at most, where the rural population health needs are among the highest in America, and where the trajectory is held near the top of the danger list for years. Welcome to Arkansas. The numbers. Arkansas has roughly 50% of rural hospitals vulnerable to closure, near the top of America per Chartis 2025 and 2026 analyses. Arkansas has historically led or near-led the nation in rural hospital risk percentage for years running. Arkansas rural obesity and diabetes rates rank at the 89th percentile or above, driving demand the closing hospitals can't meet. Arkansas rural reserves can cover patient service losses for only a few years at most per Chartis. Arkansas has not implemented the structural reforms its rural hospital network would need to stabilize. Arkansas saw federal Medicaid eligibility verification changes affect rural residents disproportionately in 2025. What it's like. Living in rural Arkansas is like dating someone with a great heart and a financial situation that is one bad year away from forcing major changes, and you both know it. Picture this. You're a 62-year-old in rural Arkansas in 2026. Your local hospital has been on the edge for years. The county commissioner keeps saying it will be fine. The hospital staff keeps telling a different story over coffee. Your kids already left, mostly to Texas and Tennessee. Your grandkids visit twice a year. You've started thinking about whether you can manage on your own if the local hospital closes. You haven't told your kids you're thinking about it, where it gets uncomfortable. Arkansas has been a leading indicator of the broader rural hospital crisis for years. The state's combination of low income, high health needs, and refused expansion has compressed rural margins consistently. The federal Rural Health Transformation Funds will help some facilities but cannot reverse the structural conditions. Sharp contrast. Arkansas and Tennessee trade the top spots on this list. Tennessee's percentage jumped faster in 2026. Arkansas has sat near the top for years. Same region, same slow-motion collapse. Number 1. Tennessee, the volunteer state with the highest percentage of vulnerable rural hospitals in America, where the crisis accelerated faster in 1 year than anywhere else in the country. There's a state where rural hospital vulnerability jumped 17 percentage points in 12 months, where 18 hospitals have already closed since 2010, where the inbound migration boom has masked one of the most extensive rural healthcare collapses in America, and where the gap between the state's growth narrative and the rural hospital reality has widened to absurd proportions. Welcome to Tennessee. The numbers. Tennessee has 61% of rural hospitals vulnerable to closure, the highest in America, up from 44% in a single year per Chartis 2026. Tennessee has lost 18 rural hospitals to closure or conversion since 2010, the second most in America after Texas. Tennessee has 27 rural hospitals at risk of closure per Chartis 2026, the third highest absolute count in the nation. Tennessee has 13 to 14 hospitals at immediate risk of closing within 2 to 3 years per CHQPR. Tennessee has not expanded Medicaid, the factor Chartis ranks as most predictive of closure. Tennessee gained 325 from 319 net residents from 2020 to 2024 per census, all while rural healthcare deteriorated faster than anywhere else. Tennessee pension system is fully funded at 104%, the strongest in America, but the pension strength has not translated to rural healthcare investment. Reddit, quote, Tennessee is the state where the headlines celebrate the population boom and the rural counties are watching the hospitals close one by one. What it's like. Living in rural Tennessee is like dating someone whose social media looks amazing and whose private life is unraveling at a speed nobody outside notices. Picture this. You're a 70-year-old in a small Tennessee county in 2026. The state is gaining people. Your county is losing them. The local hospital cut its services in 2024. Your specialist visits are now in Nashville, 2 hours away. The state legislature passed bills about migration last session and zero about your hospital. You're starting to wonder whether the state's growth includes you. You've lived in this county for 50 years. Your parents are buried here. You're not leaving. Your friends are. Where it gets uncomfortable. The 17-point single-year jump in Tennessee rural hospital vulnerability is unprecedented in modern American history. The state has been receiving massive inbound migration to Nashville and other metros. The rural counties have been losing population and infrastructure simultaneously. The two patterns coexist within the same state, producing a Tennessee where Nashville thrives and the rural counties hollow out. Sharp contrast. Tennessee and Kentucky are direct neighbors. Kentucky expanded Medicaid in 2014 and steadied its rural network. Tennessee did not, and now leads the nation in rural hospital vulnerability. Same region, one decision, very different outcomes. So there it is. 10 states where hospitals are quietly disappearing in 2026 on the public record. In Chartis's Rural Health State of the State report, in the Center for Healthcare Quality and Payment Reform Analysis, in CMS Cost Report data, in Becker's Hospital Review Tracking, in state-by-state legislative analyses, states where rural facilities are operating in the red, states where maternity wards and cancer treatment vanished before the buildings did. States where declined Medicaid expansion left the uncompensated care wound open. States where the One Big Beautiful Bill's Medicaid cuts are about to hit the exact hospitals already on life support. States where the rural reserves were already thin before the latest pressures arrived. The states with stable rural health care in 2026 tell the opposite story. The expansion states, the ones that took the federal Medicaid dollars and invested in rural healthcare infrastructure, improved their rural operating margins this year while the holdouts deteriorated. The good news, you can know this. The Chartis Rural Health State of the State report is public. The CHQPR analysis is public. The CMS cost reports are public. You can read this. Most people don't. Most people find out their hospital closed when they need it most. The reason hospitals are quietly disappearing in these 10 states is that the math of rural healthcare stopped working, and almost no one with the power to fix it lives where the hospitals are closing. The reimbursements fell. The Medicaid expansion was declined. The federal cuts are landing. The commercial insurers underpaid. The reserves ran thin. And the highest cost, lowest margin services, the maternity wards, the cancer infusion rooms, the emergency departments are the first to go dark. So the ward closes. The sign goes up pointing 2 counties over. And the next person who goes into labor, or has a heart attack, or needs chemo, finds out exactly how far quietly disappearing really is. The rural counties in these 10 states are absorbing the cumulative weight of policy decisions made decades before the current crisis became visible. The reform efforts have been substantial. The reforms have not matched the magnitude of the historic shortfall. The federal rural health transformation funds will help some facilities, but cannot reverse the structural reimbursement gap that decades of policy created. And the public workers, retirees, and rural residents in these 10 states are absorbing the consequences in driving time, in delayed appointments, in services they used to count on that no longer exist within reach. If this list helped, share it with someone who lives in a rural part of one of these states. Hit subscribe because next we're breaking down 10 American cities where the property tax bill just doubled. Drop a comment if you've had to drive an hour or more for emergency care. And remember, the worst healthcare crisis isn't the loud one in the headlines, with the press conferences and the political talking points. It's the quiet one, where a hospital closes in a town you've never heard of. The local newspaper runs one story about it, and nobody notices until it's their turn to need it.